The final supplementary. Leave it up.
6 long years, Speaker, 6 long years that this government's been in power, and they're still blaming everybody else for their failures. Like, just own up to it. All you need to do is look at their own numbers, Speaker. 3,000 physician vacancies right now across the province, right? A growing population. More physicians leaving the province every single day. And here's the problem. A child is sick. They can't get treated because there aren't enough doctors. Listen to the CEO and president of CHEO, for goodness sake. And what I and parents across the entire province are hearing from this Minister of Health is that this is not a major concern. Not a major concern. If the people of Ontario cannot trust this minister to acknowledge the extent of the crisis in our primary care system, how can the Premier trust her to solve it?
Members will please take their seats. Member for Stormont Dundas, South Glengarry.
Thank you, Speaker. Healthcare workers across the province have not forgot about Ray Days, Speaker. And I know the Leader of Opposition really doesn't like me to bring it up, but she was a staffer in the Ray government, Speaker, as well as some of their other caucus members, Speaker. It does take time to reverse the poor Liberal policies, Speaker. Unfortunately, the NDP cut the amount of residency seats by 10%. Speaker, the Liberals cut 50 seats. We are going to continue making those investments, Speaker, that are needed to ensure that our healthcare system functions properly after 15 years of Liberal NDP coalition that put us into this in the first place.
The next question, once again, the Leader of the Opposition.
Thank you, Speaker. Scraping the bottom of the barrel there. Since this question won't do anything, this government won't do anything for CHEO and their physician shortage, let's talk about Grey County. Local residents are here today in the hope of finally getting some answers from this government. They are losing all of their inpatient beds at Durham Hospital, meaning that patients can't be kept overnight, Speaker. Not only that, their emergency room is going to be permanently shut after 5 p.m. We've been raising this with the government for years now. The community has experienced rolling closures in Chesley, in Kincardine, in Walkerton, and Durham hospitals. For a month, their local councils have been asking the Minister of Health for a meeting. I mean, a call. Frankly, any explanation for any of this. But what they got? Silence. So my question is to the Premier. Will the Premier do what the Minister will not and commit to meeting with the people of Grey County today?
Members will please take their seats. And to reply, the Parliamentary Assistant to the Minister of Health, member for Stormont Dundas, South Glengarry.
Most, I think it's worth noting the hard work that the member from Bruce Grey Owen Sound has been doing on this file, both meeting with his community and the Ministry of Health. Speaker, the South Bruce Grey Health Centre is governed by a local board of directors to best serve their local community needs. Speaker, when reviewing their community needs, they've decided to refocus their resources at Durham Hospital to primary care and urgent care. Speaker, this will result in expansion of care beds at Walkerton and Kincardine hospitals as Durham shifts to primary care and urgent care, Speaker. With many patients in the Durham region community without a family physician, this focus will be imperative. South Bruce Grey Health Centre, Speaker, changes will have no impact on the level of care while retaining the existing staff. These changes will ensure a stable and sustainable healthcare system that will better serve the local needs. Speaker, the Ministry of Health, Ontario Health and South Bruce Grey Health Centre will continue to work together for longer-term solutions to healthcare in South Bruce Grey.
The supplementary question, the member for Nickel Belt.
Just to make sure that we understand, we're talking about the town of Durham, not the region. Those good people are here today. We've seen this all before, Speaker. With the closure of Minden Hospital last June, this government starved rural hospital, an emergency room with chronic underfunding. They blame the workers, they blame the community, they blame everything but themselves. After being ignored and dismissed by this government, when the community of Minden asked for help, their local hospital officially closed their door last June. The good people of Durham are here today. They are living the same nightmare that Minden lived last year. Will the Premier ensure the good people of Durham that their hospital will stay open?
For Stormont, Dundas, South Glengarry.
Let's be clear, Speaker. We blame the NDP propping up the Liberals for over 10 years as to why we're in this situation. Speaker, our government inherited a healthcare system under severe pressure due to the actions of the previous Liberal government. Under the leadership of Premier Ford, our government has made record investments into the healthcare system, Speaker. Since 2018, Speaker, we've increased the healthcare budget by over $18 billion, investing over $85 billion into the system this year alone, Speaker. Speaker, we will continue to ensure that we have the best publicly funded healthcare system all across Canada with our investments into our system. Thank you, Speaker.
Thank you. The next question, the member for Newmarket.